On the Monday edition of our Two on Your Side Town Hall, the other side of the surge. We're going to talk with a local infectious disease doctor about falling cases here in Western New York and what comes next. Plus, the Verify team digging into concerns spreading on social media that to file your taxes, you need to scan your face. Turns out that's not quite true, but we'll explain what's prompted all of this. And 3 days out from the first competition in Beijing, you're going to hear from a Western New York native who is hoping to shine in her first Olympic Games. That special report in just a bit. Good evening, everybody. We are quickly approaching the 2-year mark since the start of the COVID-19 pandemic. We all want it to be over, especially as we've been dealing with this unprecedented impact of the Omicron variant. Everyone watching probably knows someone who recently caught the virus. So, are we on the back end of that wave and maybe the entire pandemic? Let's start with the data. We showed this earlier today, but want to kind of walk you through it. It's an updated look at the 7-day total of new cases per 100,000 people. Basically, it's our best way to look at new cases, how much new virus is out there. In Erie County, that rate skyrocketed, hitting a high earlier this month, and now we're seeing a very dramatic drop, though we are still close to the previous peak from the Delta variant. Certainly, we're going in the right direction and fast, and it's part of a trend we're seeing around the country. That led the former director of the CDC to say this.
I'm more optimistic today than I have been at any point since the pandemic emerged. We have better tools, better defenses, better information, and better ability to make sure that COVID doesn't dominate our lives. We have the best chance to get and keep the upper hand against this virus.
And joining us live with some insight now is Dr. John Sellick, hospital epidemiologist for Kaleida Health. Dr. Sellick, it is always great to see you. I want to start here with a two-part question. First of all, are we almost out of the woods with the Omicron surge locally, as we showed folks the update there? And then I just wonder if you agree with Dr. Frieden when you factor in all of the natural immunity, vaccinations, these pills that are going to be readily available soon to treat high-risk patients. The coronavirus is not going away, but will the pandemic go away relatively soon?
That's Michael. Thanks for having me again. I agree that we are looking at a very good time now compared to what we have seen before. We saw that very rapid rise that you showed, and now we're coming down almost as rapidly, which is what they saw in South Africa and some of the other European countries. So hopefully this is going to hold for us. That the combination of having a probably about 2/3 of our population in Western New York vaccinated, a large number of other people who have been infected and hopefully have some good immunity from that, that we will continue to see this go downwards. You remember in the past that we got fooled a little bit, that we thought we were going down, and then we had that a second peak. Without, excuse me, that was back during Alpha, but hopefully we're not going to see that now. I think we're going in the right direction. As Dr. Frieden pointed out, we have much more availability of testing. Our data streams are much better. We have superb vaccines now. Hopefully we will see more of the drugs that we've heard so much about. They will start to come to the market in significant numbers. So that if we get down to some reasonable background level of this virus, that we will be able to manage much better going forward than what we've had for the last 2 years.
And Doctor, just a quick follow-up to that. If we look at that chart that we showed before and you go back to last January, we had the surge there, and then we had a couple of smaller spikes in March and April. So it's kind of one of these things where you're like, oh, it's getting better, and then we kind of had these couple little blips. Any reason to think that that's how Omicron is going to work as well?
You know, we can never, this virus has shown us how absolutely unpredictable it is, which is so true of these little RNA viruses with their mutations. But I think the thing that's different now as compared to the past is, again, the underlying amount of immunity that we have in the community, primarily from vaccination, but also from infection. Will hopefully blunt any of that, you know, the virus has latched on to a good chunk of the people that it will latch on to, and hopefully we won't see that kind of slide back.
We got some big vaccine news today. The FDA granting full approval for the Moderna shots for everybody 18 and up. Before it was emergency use authorization, as you can see written on the vials there that we're showing. There was hope back in August, Dr. Sellick, that when Pfizer got full approval, that we would see this surge in vaccinations and that would perhaps, kind of address some of the hesitancy that was out there. Did we see that with Pfizer? And what does that tell us, if anything, about what we're going to see now with Moderna also getting full approval?
Michael, we keep hoping that that's what's going to happen, because so many people said to us, well, this is not really a fully licensed vaccine. We want to wait and see. But to get the full licensure, the companies have to present a large amount of data to the FDA. They have to be, the requisite time period out. So they have both the data from the studies that they did, plus the ongoing collection of data from what we're seeing in the community. And we did not see a massive increase in immunizations before, and I'm not sure that we will with this, but we're hopeful that as each day that goes by, the barriers for a certain group of people to get vaccinated will start to fall a little bit.
I'm almost out of time, Dr. Sellick, but I want to ask you this. We've seen a lot of questions about another decision from the FDA. This one happened last week when the agency announced that 2 of the monoclonal antibody treatments were no longer approved to treat COVID. Like so many other things, this has gotten very political. Can you just clear up why it is that those 2 monoclonal antibody treatments were pulled?
They were pulled because they don't work against Omicron, and we're now in a situation in the United States where we're well into the high 99% of our strains are Omicron. So in the absence of data that these work, it logically made sense that they would withdraw the emergency use authorization. There is still another monoclonal antibody called Sotrovimab, which is active against Omicron. The problem is it's in very short supply right now, and it's very different regimens for who actually gets it based on their risk and how sick they are. But hopefully, just like the pills, that's something else that will become available in greater quantity as we go along, because that would be a big help as we continue to see these infections at some level in the community.
Dr. John Sellick helping us understand several different topics here tonight. Thanks so much for coming back on, and Happy New Year to you. It's the first time we've seen you in 2022.
Very good. Same to you, Michael.
All
Thank
right.
you.
Thanks as always.
Bye-bye.